Hello everyone, I'm Dr. Ashwath Kasliwal, consultant ENT specialist. So today we have a case of hemorrhagic polyp present on the anterior one-third of right vocal cord. So this is a teaching video for surgical removal of polyp with a CO2 laser. So we are operating this case with the KLS Martin CO2 laser. To begin with, we have to infiltrate the polyp with saline. This basically helps in the dissection of the polyp with the laser. While using the laser, it is important to secure the endotracheal tube and the subglottis with the gauze, as the laser beam might damage the important structures. So initially it is important to focus the pilot beam of the laser. While focusing the pilot beam, you may be required to lower the brightness of the microscope in order to visualize the pilot beam properly. An upturn forceps is used to hold the polyp and it is pulled medially. So the dissection is started just lateral to the polyp. While doing the dissection with the laser, it is important to have an adequate smoke evacuation with a suction, which may be connected to the laryngoscope. As the smoke from the laser leads to poor visualization and thus difficulty in removing the lesion. If the laser is properly focused, then the charring will be minimum. If charring is present, it is removed with a cotton applicator which is soaked in saline. After complete removal of the lesion, it is important to visualize the vocal cords with a probe in order to confirm complete removal of the polyp. I hope this video would help you in your CO2 laser surgery journey. Thank you for watching.